Hi, my name is Jody Steinauer, and I'm Professor of Obstetrics, Gynecology, and Reproductive Sciences at the University of California, San Francisco. I'm also the Director of Innovating Education in Reproductive Health, and I want to welcome you to our video series called This Is How I Teach. Today in my video, I will be discussing how to help learners handle challenging patient interactions. So I think this is really important because as clinical educators, we are helping our learners, so these could be medical or nursing students or residents or other graduate nursing learners. We're helping these learners provide patient-centered care and learn how to do that effectively. And that involves extensive communication skills that often aren't routinely included in the preclinical curriculum of health professions education. So when we are with a learner in a clinical environment, we have this exciting opportunity to help them work on their patient-centered counseling and communication skills. So I'm particularly interested in times when you are in some kind of a clinical environment and you have a learner, like I said, it could be a nursing or medical student or other health professions, undergraduate or graduate learner, and they come to present to you about a patient, and you can tell by the way they're presenting that they seem frustrated or they're experiencing some kind of challenging emotion. They might be annoyed with the patient or disappointed with how the interaction went, but you can sort of sense as they're presenting to you that there is some discontent that they have. So I think this is a really exciting opportunity to help our learners take time to reflect about what's going on for them and to think about ways to help them become aware of their emotions and to think about how they might be able to handle those emotions the next time that they interact with such a patient. So specifically what this looks like is the learner comes to you and is presenting, and let's just say you have a medical student who's presenting to you about a patient that she saw, and this is a young woman who, let's say, is presenting with an unintended pregnancy and is considering having an abortion. And as the learner is presenting to you, she seems sort of frustrated with the patient, and one piece of the patient's history seems particularly challenging for her. Let's say that this patient has had an abortion in the past and now is here for another abortion. And you notice when the learner discusses her history, she seems sort of frustrated, and maybe even when she mentions that the patient perhaps wasn't using birth control after the last abortion, and now here she is pregnant again. And I really feel that this is an important opportunity as we're helping our learners get in touch with their feelings, and also an opportunity to help them work on communication. So we sometimes jump in these interactions between the teacher and the learner to going right into the medical content. So instead of going right into what options does she have, where are you going to refer her for care, etc., I think it's a good opportunity to say, I noticed that you seemed frustrated when you were presenting this patient to me. Let's talk about that. And what I like to do is first start by normalizing that sometimes we feel frustrated by patients. And I don't have time usually to go into it, but suffice it to say that there is a large volume of literature in the medical and health professions literature, something along the line of at least 5 decades worth, that describes that clinicians can be frustrated with patients and patients can push our buttons. And these can be because of specific patient factors, but the most important thing I think when we teach is to help the learner find what their buttons are and to really own that and realize that maybe someone else might not be frustrated by the same patient behavior, but it's something that's bothering them. So I think starting by normalizing it, validating it, saying, you know, it's really common as a clinician that you might feel frustrated with patients sometimes. And it's a nice opportunity for you to look into yourself and find out what upsets you. Sometimes I even share that I, in the past, have been frustrated by such a patient, or that I'm frustrated sometimes in patient interactions. So that's how I usually start first. It's really important to make sure that your learner doesn't feel ashamed or embarrassed about their reaction. And then to say, how are you feeling? What made you upset about this patient? What exactly was the emotion that you felt? And I also think to help them reflect on whether their feeling perhaps interfered or in any way affected the interaction with the patient. Because our goal, of course, is always to provide compassionate, patient-centered care. And then I like to take a moment to help the learner think about the patient context. And this is really with the goal of helping the learner find empathy for the patient and the patient situation. So why would a woman find herself experiencing a second unintended pregnancy? Why might she not have been using birth control between the last pregnancy and this pregnancy, for example? And again, with the goal of finding empathy. And many studies have found that having higher empathy in a patient interaction improves the care we provide to patients and the patient's perception of that quality of care. And some studies have even shown, for example, for patients with chronic illness, that the more empathetic we are in the interactions with those patients, the more likely they are to take good care of themselves and to improve their illness over time. So then, at the end of that discussion, if you have time, you could sort of talk with the learner about ways that they might take what they learned in that reflection forward, so that when they're communicating with patients in the future, how might their new awareness and their newfound empathy for such patients, how might that inform their communication? Maybe they want to take a moment to go back to the same patient and maybe redo something if they felt like they weren't so empathetic or compassionate in the interaction. They might want to start over or go back and reconnect with that patient, for example. So again, normalizing the learner's feelings, helping them reflect on why they felt that way, how they felt, and whether it interfered with their interaction, helping them find empathy for the patient and thinking about how they can use those insights into providing patient-centered care, either for that patient or for a similar patient in the future. So that's what I wanted to share with you in this video on This Is How I Teach. I hope that you'll take time to prioritize encouraging learners to talk about their feelings about patients with whom they had a challenging interaction, and really keep that front and center as you go forward as a clinical educator. Thank you.